Pakistan launched its family planning program in the 1960s. However, the first evaluation of the program referred to the context as an adverse setting and put out a call for programmers to focus on the more nuanced socio-cultural, human development and social development aspects. And we see this over the last decade and a half, the contraceptive prevalence rate in Pakistan has remained stagnant. The Gates Foundation has generously invested in the SPC space since 2016 through its Naya Kadam and the Kadam Ba Kadam investments.
Through the Kadam Ba Kadam project, we are introducing a structured, evidence-based approach to SPC, one that connects national and provincial stakeholders, encourages cross-learning, and promotes consistency and sustainability in messaging and community engagement.
So it has followed a great trajectory. It was something that was very organically evolved. It was not something which is part of any project or any ongoing initiative. It is what we as leader of community of practitioners got together to think about, and it has organically grown in size. It has organically attracted other partners, other development sector initiatives. So recently in our national meeting, we have gone through the proper structure formation about elections, who could be at what post, and how could we have different thematic groups, and the chair and the secretaries of the group, and also the secretariat which has been passed to UNICEF now.
I would like to thank Pathfinder International, making all the efforts, establishing and strengthening the national community of practice on social and behavioral change. I feel that community of practice is one of those initiatives, powerful initiatives, that will enable all of us to engage and empower practitioners, to engage and empower the other partners who are working closely with the communities, with the knowledge and skills.
The Gates Foundation very generously supported the community of practice to come together and host the first national conference on social and behavior change for family planning in collaboration with the Health Services Academy in Islamabad.
The first SBC conference in 2022 led us to organize the International Public Health Conference in 2024 on SBC.
Leveraging this opportunity where stakeholders from across the country were coming together, Pathfinder International, in collaboration with UNICEF, hosted a one-day pre-conference workshop on fundamentals of SPC practice to sensitize and mobilize decision makers across the 4 provinces and key development partners to set the stage for the next steps of SPC implementation.
With Pathfinder International support, Sindh has developed its first comprehensive social and behavior change strategy for family planning and reproductive health. The strategy was developed through a structured, participatory and consultative process, followed by its validation, engaging all relevant stakeholders.
At the same time, Pathfinder was tasked by the Gates Foundation to start the development of a similar integrated SPC strategy for family planning and reproductive health for Punjab. Pathfinder International supported the Health and Population Welfare Department in Punjab to bring together their district health authority CEOs as well as the district population welfare officers from across all 36 districts of the province to facilitate a capacity strengthening and participatory action planning workshop in order to implement the SPC strategy in Punjab.
We have always been interested कि हम फैमिली प्लानिंग का जो पैगाम उसको हम हर तरफ आम कर सकें. तो आई थिंक ये स्ट्रैटेजी बहुत ही सक्सेसफुल रही और अभी जितने हमें रिजल्ट्स भी अचीव हुए हैं इन द रिजल्ट्स ऑफ एन इंक्रीज CPR इन पंजाब, रिड्यूस्ड फर्टिलिटी रेट और उसके साथ साथ जो फैमिली प्लानिंग की अनमेट नीड है उसकी भी रिडक्शन हुई।
वज़ारत कौमी सेहत ने कंट्री इंगेजमेंट वर्किंग ग्रुप की सपोर्ट से नेशनल सोशल एंड बिहेवियरल चेंज गाइडलाइंस और टूल किट तैयार की है।
These guidelines have been developed with the support of Pathfinder International and WHO. The process of development of these social and behavior change guidelines and toolkit has been an inclusive one, wherein provinces have contributed their bit. Along with this, UN agencies, development partners, and other organizations have come along in order to develop and validate this guideline.
Pathfinder International also recognized critical challenge to effective implementation, which was the limited availability of trained professionals who understood the application of SBC principles within health system strengthening programs aimed at improving the uptake of family planning. Towards that end, we supported the development of updated technical curricula that could be embedded within a Masters of Public Health program that are essential for ensuring quality and effectiveness of programs. Pathfinder International has ensured that these fundamental technical gaps are addressed, and we have blueprints and roadmaps at the national level, at the provincial level, to guide future investments in this space by the government as well as the development sector and donors.